thank you for joining us tonight. Parenting with Purpose is a free educational series for parents of school-age children with and without identified learning challenges. In the past, we've held about 3 events per school year on a variety of topics related to parenting. Tonight is a special session specifically devoted to COVID and our family's mental well-being. Before we get started, I just want to tell you a little bit about Gateways. The mission of Gateways is to enable students with diverse learning needs to succeed in a multitude of Jewish educational settings and to be able to fully participate meaningfully in Jewish life. Gateways provides services to students through congregational schools, preschools, and day schools, like Rashi, where my 3 kids attend school. Gateways also offers unique Sunday programs for students with special needs. Their B'nai Mitzvah program helps individuals with special needs prepare for their bar or bat mitzvahs. Through their teen program, where teens work side by side with students in the Sunday program, Gateways works to teach typically developing children and young adults about differences and the importance of inclusion. I'm proud to not only be the chair of Parenting with Purpose, but to also serve as a Gateways board member, which is how I know Nora, our speaker for tonight. I'm always impressed by Nora's wisdom and the clarity she provides to complicated questions and issues, so I'm very happy to have her here with us tonight. Dr. Nora Friedman is a child and adolescent trained psychiatrist and instructor in psychiatry at Harvard Medical School. A staff psychiatrist at the MGH Lurie Center, she specializes in the care of patients with autism spectrum disorder and developmental disabilities across the lifespan. She serves on the Board of Trustees of Gateways, where she chairs the Education Committee. Nora will begin with some opening remarks in just a minute, and then she will answer some questions that many of you previously sent in when you registered. If you have any other questions you'd like her to answer tonight, you can feel free to enter them in the chat box below, and we will do our best to get to those as well. Thank you so much for being here, and I'm now going to turn it over to Nora.
Good evening, everybody. Thank you, Danielle, and thank you to all of you for joining us. I know how much effort it requires to carve out 45 minutes for yourself, and for many of us, getting peace and quiet may have required pleading, bribery, and screen time, and we can get to the efficacy of those parenting tools later on tonight. But you're here now, and I hope that our discussion will be helpful. Under normal circumstances, parenting is a challenging and humbling experience. Add in a global pandemic, societal unrest, political turmoil, and it can feel exhausting and overwhelming. We're juggling so many responsibilities at once: caregiving, working, homeschooling, running a household. We've all gotten a promotion, but without the pay raise or extra vacation time. And we're dealing with our own stressors, maybe health-related, maybe financial or job insecurity, maybe isolation and concern for more vulnerable friends and relatives. And within our own nuclear family, there's an intensity to spending this much time with our loved ones. It's a crucible of heightened emotions and stress, without the usual breaks provided by school, jobs, and activities outside of the house. During these uncertain times, many of our kids need us more, even as we feel worn down and pulled in so many directions. Here, our mindset really matters. We can acknowledge how difficult the situation is and also recognize the opportunities to reconnect with our children and to deepen those relationships. We can try to provide structure while also embracing the gift of flexible, unstructured time. We can create new family rituals. We can try to grow as parents, partners, and caregivers. There will be lots of missteps and stumbles along the way, but the beauty of this extended quarantine is that every morning we get to wake up and try it again. So I'd love to turn it over now and try to get to some of the questions that the audience submitted in advance.
Okay, great. So our first question, Nora, is how do we take care of our own mental health while we're so worried about our children's mental health?
It's a really excellent question, and I think it's so paramount for us to be thinking about our own mental health and needs. It's not selfish. It's essential for us to be able to give care to other people. So first of all, healthy lifestyle habits, staying active, nutrition, good sleep, trying to engage in calming and pleasurable activities. For some, this could be mindfulness and meditation. For others, it may be art, cooking, gardening, organizing closets, binging on Netflix shows. There's no right or wrong approach to that. It's also really critical for us that we are maintaining social connections and supports with family, friends, therapists. And most of all, if I could give some advice, it would be to adjust your standards, discard any of the expectations that aren't serving you right now. Stop comparing yourself to the curated images of family bliss on social media. Remove any feelings of guilt. Show yourself a lot of self-compassion and find moments to express gratitude when things actually seem to be going well. And as parents, I think one of the most important tools that we can practice is being mindful in our parenting, being present in the moment. Our ability to be attuned and empathic to our children allows us to be responsive to their needs and help them to navigate this really challenging and uncertain time.
Okay, thank you, Nora. Please share tips to foster resilience in children during this time.
I think many of us have heard through the media, reading articles, that creating routine and structure is an important piece. And it really is, because it helps kids have a sense of security. You know, in a typical time, they're spending 7 hours at school and an additional set of hours each day involved in other activities and pursuits. So that's a lot of free, unstructured time, and that can be really overwhelming for children and adults to navigate. I think it's also important to find a balance between limit setting and also being flexible. We are in extraordinary circumstances, and often it feels like we're in kind of survival crisis mode. And so being able to appreciate when to toe the line and when to give a little can be really helpful. One of the challenges when you're spending almost all of your waking hours together with your children is trying not to fixate on the grievances and the negative behaviors, but reinforce the positive behaviors. And this is something that I personally as a parent am working on all the time. Be an empathic listener, try to find ways to connect with your kids. And here it's really the quality of your interactions that matters more than the quantity. So find ways to carve out uninterrupted intervals of time when you can really be fully present and engage with them in positive ways. These interactions, even if they're not very long, help give your kids that sense of security and stability that they're craving. You also need to work with kids in a developmentally appropriate manner to recognize and identify their feelings and to find productive ways of managing their distress, their anxiety, their anger, their frustration. And here our own modeling becomes really critical. How are we showing kids how we manage stress? And when we react in frustration or anger, how do we model apologizing and resetting and then moving forward?
That's great. Thank you, Nora. Okay. Is it common for children to internalize their fear of COVID and the unknown? If my child is not expressing any fear or concern about COVID, should I be worried that he or she is internalizing everything and bring up the subject myself?
So temperament, coping style, the environment around them all influence how a child is going to react to stressors. Some kids will internalize their worries, while for others, stress and anxiety will manifest as challenging behaviors. So give kids an opportunity to talk about their fears and how they're feeling, but do so gently. Depending on their age and their maturity, they may not have the vocabulary to express what they're experiencing. And that's one of the tasks that we can help them with, is learning to name those emotions, to give voice to them. It's also really critical to validate their feelings. It can be helpful to approach these conversations matter-of-factly, try to elicit what their understanding of the COVID-19 situation is. You should share age-appropriate information and answer their questions, and then also reassure them of all the efforts to keep them safe and healthy, and what you as a family in particular are doing to protect them.
How do we navigate supporting our children of all ages with autism spectrum disorder and anxiety disorder from the spikes in anxiety that come from reading and hearing the daily news in such uncertain times?
I think for all kids, it's really important to titrate the exposure to the news that they're getting. So maybe that means you're doing your reading or listening to the news or the podcast when they're in bed or occupied with other activities. For older children who probably have a lot more independence with regard to the content that they're consuming, check in with them, encourage them to share with you what they're learning, make space for open dialogue with them so that it doesn't feel like it's a taboo subject. And it also means for younger children or those who tend to be anxious that you shield them entirely from the situation. It's just important to deliver information in an age and developmentally appropriate manner. We should also follow their lead as to how much they want to know. We may feel like we need to deliver more information and they may be content with, a few brief responses. So you don't have to keep pushing if they're not prodding you for that. And just one word about individuals with autism spectrum disorder. For that segment of the population, just their usual schedule due to the COVID crisis is really challenging for many of them. So find ways to create consistent routines and to help them build their coping and calming strategies.
Okay. How do you encourage continued independence in younger children while also recognizing that this confusing time has made children more dependent, uncertain, and clingy?
So over these last months, many children have likely had a regression in some domain: sleep, eating, toileting, behavior. I wouldn't want to put anybody on the spot, but I'm sure if we ask for a change of hands, most of us would be affirmative to at least some of these issues with our kids, regardless of their age. And as a parent or a caregiver, it's really important not to get discouraged or frustrated with these backslides, which often represent their response to the anxiety and uncertainty that they're experiencing. It's so hard to do in the moment when you're feeling overwhelmed and exhausted, but try to be patient and reflect on what's driving this change in behavior. Maintaining routines, providing lots of positive reinforcement for those tasks that children are completing independently is one piece of trying to help foster that. But also be flexible. Decide which problems you want to tackle now and which you're willing to live with temporarily, recognizing that many of these challenges are going to subside when your child is feeling less stressed and life seems to return to more of a normal pace.
What are some ways to maintain equilibrium in children and teens' mental health despite the lack of social interactions? Are there coping strategies we should be giving them or using? How do you balance complete isolation with allowing some social interaction? And how do you set and maintain parameters such as wearing masks, etc.? What are some safe ways for children to play together during the summer aside from bike rides?
So there are a lot of great questions packed into that. So with regard to trying to maintain equilibrium for children and teens' mental health, first, as I mentioned, you really want to encourage open conversations with your children about how they're doing and how they're managing during these challenging circumstances. It's not necessarily a discussion you need to have on a daily basis, but checking in with them periodically. The situation around us is changing, and so it's important to see how they're reacting and responding. And one of the most important lessons for parents, regardless of whether there's a public health crisis or not, is just learning to sit with your child's negative feelings, whether it's anger, frustration, disappointment, sadness, fear. Don't feel the need to swoop in and to brush away these emotions. Teach them that they can tolerate these feelings, that you can tolerate them having those feelings, and then help them to problem solve. Teach them to develop coping skills, finding ways to relax, reduce stress, and self-soothe. Those kinds of strategies will look different for kids depending on their age and their developmental level. Could be reading, music, physical activity, deep breathing, mindfulness. And with regard to the social questions, we know how important it is for people to stay connected, and especially for kids, to friends and relatives. For many of us over the last few months, that's been virtually. It's been through calls and texts, online interactions using social media, video games. Now that some of the restrictions are easing and the weather is warmer, kids may be seeing friends in person. So set clear parameters with your children about your social distancing protocols. Wearing masks, practicing good hand hygiene, staying outdoors as much as possible. Remind them of why we take these precautions, and remember that kids are going to need probably more parental oversight to maintain appropriate boundaries. Both younger kids who just have a harder time understanding, and teenagers who tend to view themselves as invincible and can be impulsive. And I think it's also important to explain that every family is going to have a different assessment of risk and comfort level with the current situation. So make sure your children understand your guidelines and your rationale. And as people are starting to branch out, it may be helpful to keep social contacts limited to a few other families who seem to approach social distancing similarly.
Okay. I can't wait to hear your answer on this next one here. How much online exposure / screen time is too much?
So the good news is there are no specific guidelines right now. The American Pediatric Association had a recommendation of limiting screen time for preschool children ages 2 to 5 to 1 hour a day, and then 2 hours a day for children over 3. They released an updated guideline in March, I believe, at the start of the crisis, but did not provide updated time limits. And they say that that was intentional, that right now it's hard to give specifics to families. So I think it's helpful to not focus on specific time limits per se, but to think about another rubric that's often discussed in the literature, which is child, content, and context. So you know your child the best. How do they react to screens? Do they get agitated and overstimulated? Do they get anxious? Do they get fearful at night? Does it disrupt their sleep? With regard to the content, is it appropriate for their age and developmental level? Do you know what they're actually viewing and consuming when they're online? And then the context, how are they using screen time? Are you doing things together as a family? To be honest, right now, I'm sure most of us are using screen time as a way to occupy kids so we can get done one of the 100 other things we need to do. Are kids playing video games alone? Are they using it as an opportunity to connect with friends and family? So how they're using media matters. And a Zoom call with friends playing trivia is very different from sitting alone in the basement playing NBA 2K for hours on end. It's also really critical now that most kids' consumption of media has increased to check in with them about their digital footprint, reminding them about safe online interactions and potential dangers. And this goes for kids of all ages, especially teenagers who likely have more independence. We also want to try to avoid screen time use, an hour or so before bedtime, since the blue light emitted by devices can interfere with sleep. And I think one of the most helpful things now is to try to create some tech-free times for your family. Could be short, for many of us, it might be meals or other times, just to help kids sort of move away from that and reset and interact with the family. And for those of you who aren't familiar, Common Sense Media is a really great, helpful website for parents reviewing age-appropriate apps and games, and can really help provide some useful advice for helping kids find appropriate online content.
Thank you, Nora. That was very, very helpful for me. What are your thoughts about the impact of students being out of school, homeschooling, virtual schooling? In particular, if some students end up learning from home again in the 2020 to 2021, the next school year, or if schools end up going remote again fully?
So 4 months into quarantine, I think many of us acutely feel how the virtual world that we're inhabiting falls short of the power of in-person social connections. And the impact on our kids is likely even greater because they're missing the opportunities for social emotional development and building peer relationships that come with those in-person interactions. For parents and caregivers, many of us discovered that remote learning often requires a good deal of adult involvement and supervision, especially for younger children or children with different learning needs. So if the fall brings more virtual schooling, I think on the one hand, we'll be better prepared. We'll have experienced it for a few months and we'll have had some familiarity with the challenges that our children and ourselves faced, and maybe we'll be better positioned to tackle some of those difficulties. And I think it'll be really critical to continue creating that structure and routine, and also maintaining ways for kids to stay connected with friends and loved ones. What could be tough is in the fall, they may have to revert back to virtual interactions after some easing over the summer and maybe seeing people in a socially distanced manner outside. So I do think there's a lot of uncertainty about what the fall will bring and what school may or may not look like. But hopefully we'll all be a little bit better prepared this time around, having had the experience of the spring under our belt.
How do we balance increased anxiety in children with their academic demands during the school year?
So the first step is to try and understand what seems to be driving your child's anxiety. Is it a reaction to the COVID-19 situation, concerns about their own health, or that of their loved ones? Are they having difficulty adjusting to social distancing measures and being separated from friends and family? Is it school related? Do they have learning challenges that make school a stressful experience for them? If you can start to identify the triggers for their anxiety, you can help your child to process those stressors and find ways to problem solve. It's also really important to think about ways of reducing stress in other areas of their life. So setting realistic expectations for them and giving them a sense of control and agency in those areas of their life where they can have it. And one caution I have for parents who are caring for children who tend to have an anxious temperament is that right now there's a great deal of intimacy between families. We're spending a tremendous amount of time together. And that is both a blessing, but can also pose a challenge for children who are anxious, who have separation difficulties, because it may make the return to quote normal life in the fall or whenever it happens more challenging because they're comfortable being at home. Not every child is having a negative reaction to having been homeschooled in the spring. And so if you have a child who has some of those issues and challenges, it's important to keep fostering their sense of independence and their ability to continue mastering those skills. And that's a really fine line, but I do think it's important for parents in those situations to be aware of and to be thinking about how to maintaining those gains for their kids and not letting the child's anxiety dictate how they're responding all the time.
How can grandparents best support their children and grandchildren?
So I think this has been tremendously hard for so many of us, whether our families are local or out of state or out of the country. It's so important for us to be connected to parents and grandparents. And fortunately, we have lots of tools to do that virtually. And for some of us with local parents through socially distanced outings or in-home visits or shared living situations, depending on everybody's family arrangements. So here, every family really has to make their assessment of risk based on family members' health, as well as consideration of the mental health effects of loneliness and prolonged separations. Some parents rely on their grandparents for childcare, especially since schools, camps, and other programming are closed. And so one family's decision may be very different from yours, and we have to trust that people are thinking these questions through carefully and coming up with a decision that meets their needs and meets their level of risk and comfort. For those of us who are maybe not connecting with grandparents the way we were before the quarantine, we have the opportunity to create new rituals with them, to find activities that they can share with their grandchildren over FaceTime, preparing meals over Zoom, having gatherings spaced out in the yard. So I think just trying to think creatively about spending time, staying connected with them, and celebrating the milestones, big and small, can help ease some of that separation and loneliness.
Okay, and I think this is our last question. How can we best deal with shared custody during this time?
So it's a great question. You know, in an ideal world, both parents would agree to social distancing measures and other health precautions that both households would practice, allowing the child to move between the two residences. Of course, the reality is often much more complicated. Parents may adhere to social distancing differently. They may have different health risks and evaluate the issues with COVID differently. They may have changed work obligations that make the usual custody schedule harder to follow. In those situations, families may have to rely on video calls or socially distanced outings to stay connected and to think about ways that maybe providing makeup time for the parent and child if they miss their scheduled visits. And just as we talked about how to connect with grandparents and to think about going about play dates and opening up socially, we have to think about the effects on a child's mental health to not have the same kind of routine or to be missing the in-person contact with another parent or caregiver. And those need to be factored into the risk assessment and figuring out the best arrangement in these really unusual and challenging circumstances.
Okay, great. Thank you so much, Nora. So that it ends the questions that were submitted prior to our event. So we do have a few questions that came in through the chat box, which I'll ask now. And for those of you who may still have questions that you want to submit, please feel free to do that now as well. So a question: how do we sort of determine the risk benefit of allowing our children to see friends, go to parties, hang out with kids in the neighborhood? How can we sort of how do we sort of figure out how to make decisions around whether to allow that or not?
I think we have to be very well versed on the guidelines from the CDC, from the American Pediatric Association, from our local state and government and national government agencies. There are really clear directives on how we should be approaching social distancing and how we should be approaching the easing of some of those restrictions. And that's maintaining 6 feet of distance, wearing masks, practicing good hand hygiene, trying to stay outdoors. So obviously this is varying from state to state and locale to locale and from family to family. And as a physician and a parent, I take those guidelines seriously, and they certainly influence much of my decisions. As I mentioned earlier, we all still have to factor in, how are we going to make it through the summer? How are we going to make it through the fall if normal life is not resuming anytime soon? And so finding a level of risk that is tolerable for your family. And that's going to look different for everybody. And it's going to depend on your home situation and whether you're interacting with other relatives who may be more vulnerable, have underlying risks. But I think it's important to be thinking about the emotional effects of prolonged isolation and separation from friends and loved ones, while also appreciating the risks that are still very much present. Even if caseloads are decreasing, coronavirus is still around, and it'll be interesting to see over the next several months, with so many states easing their restrictions, whether cases are going to rise again significantly, what things will look like in the fall. And I think Dr. Beebe, who's talking next week, will have a lot more to share on that topic. But again, it's a risk assessment, and we have to all make a calculus that factors in the priorities for our own families.
Okay, let's see. How do we help children who feel like, according to social media, this is a good one, everyone is basically done with social distancing? So you see friends hanging out with other friends on social media. How do you sort of manage that, especially with your kids, when your kids see their friends doing it? How do you what do you say to that?
It's a great question. I think it's really hard. I think it's important to have frequent conversations with your children about the precautions that your family is taking and the rationale for why you're taking them. Maybe it's because you're also seeing grandparents who are more vulnerable. Maybe it's because you're an essential worker who has a potential for more exposure and you're trying to protect other people around you. This situation is an opportunity to really teach your kids about empathy, perspective taking, and altruism. How to do things for the greater good, even if it's uncomfortable for us, even if it means we're sacrificing some of the things that we really love and we really want. And so, again, help your kids to understand the decisions your family is making and allow them to express all of their frustration and anger about those decisions and sit with it. And if you continue to talk about it, ultimately, hopefully they will come to a realization that this is the way it needs to be right now. As I mentioned, it's a fluid situation. Everything is changing, and what we're doing now may be different a month from now, may be very different in September, may be very different in November. So trying to share some of your reasoning with your kids can be really helpful. I think rather than just sort of that knee-jerk, because I said so response, try to help them to understand. It allows opportunity to have great conversations about the science of coronavirus and how it spreads and public health measures we can make and sacrifices that many people are having to do in this challenging time. And find ways for them to connect with their peers otherwise. Maybe it's a socially distanced event in your backyard where you can supervise a few children and make sure that they're doing things appropriately, rather than sending them off where you're concerned that they may not be adhering to the guidelines that your family has made.
Okay, any advice on helping navigate and enhance sibling relationships when that's their primary social interaction and the older sibling tries to manage and dictate all manners of play?
Well, if I had the answer to that, I'd be a very helpful parent. But I usually am better at dispensing advice than following it in my own household. Look, these siblings are spending every waking moment together in ways that they typically don't, especially for those of us with older kids. They don't spend all school day together. They do different activities. They have different bedtimes usually. And now they're together all the time. And if you think about it, parents and siblings are really filling the role of primary social contact for our kids. And that's a really hard thing. So I think it's inevitable that there's going to be friction and conflict, and personality styles will emerge. And it's challenging, but it's also an opportunity to help teach your kids how to step back, how to take perspective, how to be kind and thoughtful to others, how to be flexible with what activity they're doing, who's getting the iPad next, who gets to choose what we're having for dinner. So these are life skills that are going to serve them really well. But I think it's even more challenging now because tensions are just running higher. They're together all the time. So I think it takes a lot of frequent reminders and conversations. And the best time to do that, of course, is when everybody's calm, those moments of peace, when you have them in your family to broach these topics and to do some perspective taking about how a sibling might have felt when another one was dictating what they should be doing. And I think just, again, having those conversations and having some strategies that you've pre-discussed with your kids. So when you're in those situations, you can use one or two words to get them to sort of step back and reset. But this is going to be an ongoing issue, I think, as long as our kids are in very close quarters for the foreseeable future.
Yes, absolutely. Okay, a couple more that we have here. How do I get more cooperation from others in the home, especially my children, to help with cooking, cleaning activities, other chores, etc.?
Also an excellent question, yet to be fully answered. Look, I think we as parents are so acutely aware of how much we do on a daily basis. It just feels really magnified right now because it's on top of everything else that we've added on to our responsibilities for the day. I personally feel like I spend probably a quarter of my day washing dishes or cleaning the floor after my kids have eaten. Similar to the sibling dynamics, talking to kids in moments of calm and helping them to understand your perspective. That if you spent less time unloading and loading dishes, you'd have more time to play games with them or to take an evening walk or to go do catch or whatever it might be. And it's hard for kids, they don't necessarily have the ability to step out and see the ways that they can be helpful, especially for younger children. So in those cases, creating responsibility charts or a chore wheel can be helpful. So it's just part of their structure. It's built into the routine. Mondays, you're washing down the table. Tuesdays, you're putting away your laundry. I think it's really effective if you just integrate it into the daily schedule. So there's less surprise by it. It's right there. It can be tied, of course, to some of the positive things they can earn, like screen time or a Zoom play date with a friend. But again, step back and appreciate that for kids, it's not usually part of their wheelhouse. And so just helping direct their attention to the challenges it creates and the ways in which they can be helpful. And as I mentioned before, you're giving kids an opportunity to really help others and to learn the positive feelings that come from that, even if they are complaining about it along the way.
Okay, and I think I have one last question here that may have gotten answered previously, but I'm going to ask it anyway. Um, how do you suggest we answer constant questions that children may have about COVID, like specifically around why do I need to wear a mask? Why can't I see my friends?
Yeah. I think some kids, depending on their level of understanding of the situation, their anxiety, their uncertainty about it, just may require more repetition of the facts. And that can be really hard as a parent if you feel like you're giving the same answers all the time. I mean, how many times do we tell our kids it's time to shower and they say, why do I need to shower? Well, because you've been outside all day and you're covered in sunblock and you were rolling in the dirt. So we're kind of used to that pushback. And so just recognize that some of that kind of repetitive questioning is a reflection of the uncertainty and the stress that your child may be feeling. There are some great social stories on the web or other kind of handouts and online media that have been created for kids to help them understand the situation, social distancing, hygiene practices. And I would encourage people to look for those because sometimes it's helpful to refer them to something so you don't feel like you're repeating the same information all the time. But I think just recognizing that, you know, that's a reflection of what they need in this moment. And we have to try to find space when we can to answer their questions and to reiterate the need for these social distancing measures right now.
Okay, thank you, Nora. So I think that's all the questions that we have. So anyway, thank you very much, Nora, for your insights around this difficult topic. I know that I'm leaving feeling more knowledgeable about sort of how to manage the day-to-day challenges and have a more positive outlook, try to see sort of how I can make the best of the situation with my family. It's definitely very challenging. I know for me, it's especially challenging managing all the screen time. So that was helpful for me to hear what you had to say about that and how to sort of look at it through some different lenses. And I also just wanted to say that I especially liked your point around how we can take this opportunity to teach our kids about altruism and empathy for others, and about sacrificing something for the greater good. I think that's a really, really hard concept for young ones. And I think this does provide a unique opportunity to try to help develop some sense of what that means. So I think that's great. Thank you so much.
My pleasure.
I just wanted to let everybody know that we have another session, same format to this one on Monday, this coming Monday, June 29th with Dr. Benjamin Raby. His discussion will focus more on the medical side of COVID, parenting our children. He's the chief of pulmonary medicine at Boston Children's Hospital. And if you have not already signed up, you will receive an email after tonight with the information. So thank you very much for joining us tonight. And we hope to see many of you on Monday.
Thank you. Bye, everybody.